the digital health reporter for MedCity News. Thank you for joining us for this Invest Now segment, where we're going to focus on the Israeli digital health landscape. In this session, we're taking a look at the Israeli healthcare startup landscape through the dynamics of the digital health market in Israel and what's happening, particularly what's happening with technology incubators there. I think we're about up to 18 at this point. So I'm joined by Stephen Shapiro, who's a co-founder of eHealth Ventures, and eHealth is a consortium of healthcare providers, including the Cleveland Clinic, Maccabee Healthcare, and others. Their mission is to fund, and grow early-stage digital health companies. eHealth Ventures closed its first fund of $10 million in 2015 and was awarded a license by the state of Israel to run an incubator. So I guess that's news. So congratulations for that.
Thank you.
They're investing in digital health companies, and through their partners and strategic relationships, eHealth plans to commercialize portfolio companies worldwide. Now, Stephen, your background comes from well outside healthcare, particularly in the world of cellular phones and computer services. I think you worked as a management role at Cellular One, and that was a company that later became part of what we know as Verizon. And you led a spin-off company that became known as AT&T. That's right. So how does someone come from that kind of background to move into digital health investment?
Sure. So I've been fortunate in my career in the late 60s, being in computer science, and then in the middle 80s into cell phones. And what is more cutting edge today than digital health? And I see many parallels from the cellular phone industry, especially in the early days, versus what we're going through in digital health. When I started in the cell phone, they were predicting 1 million subscribers by the year 2000. I think by the year 2000 in the cellular phone industry, there were more phones than people in the United States. And it was like the Wild West of growth. But we went through many challenges, regulatory challenges, both with the FCC versus the FDA in healthcare. We had a lot of local. We actually had to have pricing approved by the local public utilities, a lot of building towers, so many regulatory, which is similar. Another thing that the dynamics of cellular, before cellular phones, a phone number went to a place. Today, a phone number goes to a person. So the transformation of digital health is really being mobile and delivering healthcare to a person, not to a place. And we're seeing that evolve with the help of digital health. A big one is the lack of interoperability in healthcare, especially in the United States. And that's always been a challenge. I don't know how many of the viewers will remember the early days of cellular, but we're in Chicago right now. And if someone were to call you from Philadelphia to Chicago, they really couldn't. The only way they could do it is they would have to call the cellular network in Chicago, knowing you're in Chicago. Once they're in the cellular network of Chicago, they would then dial your phone number and it would try to find you. And that was really awkward. And we know, what the issues are in interoperability in digital health. So there's a lot of parallels. So about 5 years ago, I got contacted by someone I worked with in the cell industry, George Blumenthal, and he's amazing person, built tremendous wealth for many in cellular phones, and he got into healthcare. So he asked me to join him in a company involved in digital health. And all of our development was done in Israel. And so we had software for electronic health records for primary physicians We were cloud-based. We qualified at the time in all 44 quality measures for meaningful use. So I kind of jumped in and really learned it. And then I did a little research, and I found this very interesting when I got into healthcare. I found an article that said, related to healthcare, said this will never get general use. It won't be adopted. It takes too long, and the patients, as well as the doctors, really won't adapt to it. And this article was from the London Times in 1832. And what it was talking about, if I can get it out of my pocket,
All right, you're from
is a stethoscope. Anyway, you can see it's there.
Yeah, it's not an appendage.
But you think about the adoption of new technology. Here we go.
Yep.
And when you think of a doctor today, they have a stethoscope. When you think of a doctor today, you think of a stethoscope. In March, just last month, it was the 200th anniversary of the invention of the stethoscope, which was done in France. And today, it's still relevant. So I found that very interesting. And to really get into healthcare, it's really, what you're delivering. It's not tied to the device. As in the cellular phone industry, we learn it's not the device that you're hooked to, it's what is delivered and what can it do for you. And I think we're seeing that same thing in healthcare.
Sure. So, but what made you start eHealth Ventures, and why Israel in particular as an area to invest in?
Thank you. So we spent a lot of time in Israel with our development and looking at the healthcare system in Israel. And what I found very interesting, and these numbers I got from the CIA website. In the United States, 17.3% of GDP is in healthcare, probably the highest in the world. In Israel, it's 7.2% of the GDP. But how do you measure success? One is financial and efficiency. Another is what it delivers. In the United States, the average American lives just under 80 years, which is 41 in the world, the 41 nation in the world in how long we live, and we're the highest cost. In Israel, the average Israeli lives 82.3 years, and which is 11th in the world. And this is from the CIA. So I found that very interesting to kind of dig in on what's different in Israel. And another thing we found out is so much innovation is happening. So a colleague of mine that's Israeli that I worked in the digital health space, he said there's a great opportunity for investments using funds that are provided by the government. So the government of Israel has the ministry department, the economic minister, and under that program is the chief scientist. And the chief scientist has developed many different grants and programs to help R&D and innovation in Israel. Israel is a small country of 8 million people with very few natural resources. So for their economy to grow, they have to create within. And they saw, with the high educated, highly motivated people in Israel, let's put some financial incentives and grants. So to throw a number, in the last 10 years, the Office of the Chief Scientist of Israel has invested $100 million per year in R&D efforts through various programs.
Wow.
And one of those programs is the incubator program, which they created in 1993 to take advantage of a lot of the Russians that were immigrating to Israel that were very highly educated, and they were looking for them to do things other than musicians. And they created a very creative program, and which should I,
Oh, yeah, I mean,
get into
you just, because it's going on since 1993, but it seems like in the last few years we're seeing a lot more in the way of of U.S. Companies getting into the incubator market. Yeah, could you tell how some of these structures, because it seems like there's a lot of convergence.
Right. So from 1993 to 2003, there were 1,900 companies that went into an incubator. Of those, 1,700 graduated. Of those, 44% raised money, private equity money, and 30% have been successful. And so the government wants to create the environment to de-risk this in technology, and especially when you look at healthcare, for somebody that has an idea, what percent of those ideas really go forth and commercialized and they make money?
Sure.
And so let me tell you how it works. So the government will franchise to a consortium a license to run an incubator for 8 years. Some of the recent ones have included U.S. companies such as IBM and Medtronic. Did one in Haifa with Patango, a large VC, as well as a hospital.
Sure.
And so that's an example.
Sure. I guess OrbiMed did one with Takeda Pharmaceuticals and Johnson & Johnson in 2014 too.
So we formed, so we said, wow, no one is focused totally on digital health. So my partner and I reached out and we met and have a great relationship with Maccabi Healthcare in Israel. And they are now a 50% partner with us. And Maccabi is the second largest HMO in Israel. And Israel and HMO does insurance as well as healthcare. They're one of the leading healthcare IT companies in the world. They have been for many years paperless, which means if you're one of the 2 million Israelis that belong to their HMO, in your life going through all of your healthcare needs, you will never see a piece of paper.
Sure.
And so that one of our partners. Then we were able to partner with the Cleveland Clinic. That I have a lot of ties to Cleveland. I was in the cellular industry there. And we have a great group of people we work with, Tom Sudo, Dr. Marstovsky, that are in Cleveland Clinic Innovations. They're one of the world's leaders in commercializing technology. We're in Chicago right now, and in an hour I'm meeting with my partner from Avi Pharmaceuticals out of Chicago. We have some partners in China and Europe. So how it'll work is we will identify companies that there's a true need for. And that's why I need these medical professionals to say, it may be great technology, but if they're not solving a problem, it may not make sense. How do they get reimbursed? What is the payment model?
Right, because the landscape or the dynamics behind the U.S. healthcare market are much different and much more complex than they are in a nationalized health system like Israel.
Right. So we will identify this up front, as well as where they'll sell to. It could be sold in the U.S., it could be sold in Asia, it could be sold in Europe. And so once we identify somebody, they will go into the program for 2 years. And in that 2 years, each company will receive $500,000 US for that 2-year process. Of that, 85% or 425,000 will come from the government of Israel, and 75,000 or 15% will come from our limited partners. So that this way we've de-risked it, and it's highly leveraged investment. Over the 8 years, we will have 40 companies go through our incubator, which will be an investment of $20 million, of which 17 million come from the government of Israel and 3 million from our limited partners. So we have an investment platform to really leverage on this. Right.
I mean, so and the idea is that the Cleveland Clinic would run some of the pilot programs to support the road to commercialization in this country. Is that
right? So there's three phases. So the first is to identify which companies to invest in the first place. And they're a great value. We've looked at 100 different companies in the past 15 months in Israel. And it's so critical, as any investor knows, is how do you pick the winners, the right ones.
Right.
So we want to clinically validate as best we can at the early stage. So that's the first role they and other partners play, as well as Avi Pharmaceuticals. Then once they're in the incubator, they have $500,000 for that 2 years, and part of that will go through trials, clinical trials. Some will be done in Israel through our partners at Maccabi Healthcare. Others it may make more sense to do at Cleveland. So certainly that opportunity is there. And then the third side is commercializing. After 2 years they graduate, we pick the cream of the crop on which ones we feel will be the winners, so we can lead investments and invest in those. And Cleveland Clinic will play a major role in helping commercialize and take those to market.
Sure. And you've made some investments so far, right? You've picked a few companies. What could you give some examples of the kind of companies you like? And are they pursuing? Do they have different business models powering them, or are there a lot of similarities? Are they more like on the clinician-facing side, or are they more on the patient-facing side?
Okay, good question. So the first company we invested in, which was about 15 months ago, is called Intendu.
Oh yes.
And Intendu, they work with people that they help with rehabilitation for people with brain damage. And they use, right, for brain injury, they use biogaming technology, which is very common. Many people know it, especially if you have teenagers at home, and where you can become an avatar in a game. But their magic sauce is not the gaming itself, it's what is behind it. So it's used, initially it was just used in Israel when we first got involved. Since then, they have a number in Richmond, in Atlanta, the Mayo Clinic. Some are doing trials, some are actually paying customers now. Shepherd in Atlanta is doing it. Virginia Concussion Center out of Richmond, and others. And so the patient, the therapist will use this technology to help them, really, the person with the brain damage, with their mind-hand coordination. How can they get into real-life situations? How will they respond? And the game will simulate a real-life adventure.
Right.
And as they go through it, maybe the game is too fast. Maybe it's too difficult for them. So in real time, the game will adjust so the person can have some wins and get confident. And then it'll speed it up. It'll add more levels of complexity. Are they just doing one thing, just catching a ball? Or is there some balls they don't catch, other balls they do? Are there people that are involved? It'll actually increase the complexity as the person progresses and learn. And all of this is documented for the clinician to use. So at first it's done in the clinic under the supervision. And in our next phase, and we're actually, so we invested in them and we have a board seat, I'll disclose. And now we're helping them raise their Seed B funding, which actually our crowd, which I could talk about in a minute, is one of the investors in it. And all the existing investors actually put money into the next round to maintain their position, which speaks a lot for the management in hitting all their milestones. Sure. So their next is taking it to the home. So it's almost like you go to a gym and you have your trainer there, and it's very regimented and structured, and he knows how you're doing. Then when you go home, you do the same. And maybe it's not as good, maybe the trainer doesn't know, but you could take this technology at home to your Xbox or other similar technology, and it records everything you do. So when you go back to the therapist, they'll look at it. So then you get into a question where, so in this case, this is sold to the clinic, it's not sold to the consumer.
Right. Right.
So
and so you've been dealing a lot with startups from Israel, and you've seen what's gone on in the U.S. Would you say that there is a difference between sort of the mindset of entrepreneurs in digital health coming out of Israel compared to what you're seeing in the U.S. as far as expectations are concerned? What they tend to ask for, what they don't tend to ask for?
great question. So for those of you who haven't seen it, this is Israel's kind of been known as a startup nation, and the amount of innovation that has come out of Israel, especially in the last 10 years, has been off the charts. Tel Aviv was ranked as the number 5 environment for startups in the world by Compass, which is a Silicon Valley research company. Jerusalem is on the top 50 and growing very strongly in healthcare. And there's many reasons for it. I guess it all starts with the people and the culture of the people. So in Israel, serving in the military is a requirement. So right out of high school, all Israelis go into the military. And they learn a lot of discipline, a lot of structure, how to be creative thinking, how to react under stress, and they mature very rapidly. And so that's a key reason. Another is they're not afraid to fail. And that's the fault of many entrepreneurs, is they will not necessarily do the right thing for fear of failure.
Right.
And in most entrepreneurs that I've met in Israel, and I've met many, they have had maybe 2 failures. In fact, very few successful, if any, have really jumped into it for the first time and have been successful.
Okay.
So the culture there is so different than we see here.
Sure. So just looking ahead, the next 12 months to 2 years, what do you see as kind of the milestones for what you're doing as far as the investments you're interested in, technologies that maybe you haven't invested in yet that you think are kind of compelling?
Okay, thank you. So the beauty of Israel is it's really become a hub for technology in cyber, in healthcare, in IT, one of the top in the world. And so we feel we're in the right place. And we want to provide an investment platform that people that want to invest in this startup nation boom. And the beauty is we're not passive investors. We will only invest in a company that we can add value to.
Okay.
And one of the Israelis are great at technology. They come up with amazing things. And Waze is probably the best example that was sold to Google for, I think it was like $1.2 billion.
Okay.
But they need help when it comes to commercializing it, to understand in the U.S. it's very complicated, the payment and how you get paid and what you'll get paid in the healthcare with the reimbursements, with FDA clearance. There's a lot of regulatory hurdles. It's a little different in Europe and a little different in China. So we want to identify companies that we can help through this process and add value.
Sorry, you all right? Okay.
Sorry.
Okay. That's okay. And I think that brings us to the end of our conversation. So thank you very much, Stephen Shapiro.
Okay, thank you, Stephanie.
From eHealth Ventures. Thank you for joining us.